Cardiac catheterization is often valuable in the evaluation and treatment of patients with congenital heart disease. Now, this is really considered a very safe approach in the non-acute setting. But what about patients, say, postoperatively? It's usually considered high risk. But we have a paper we're talking about in the December 2014 issue of JACC Cardiovascular Interventions, and I am with Christopher J. Petit, who is MD, Children's Healthcare of Atlanta, Emory University, where you're an associate professor of pediatrics. You're the senior author of Cardiac Catheterization in the early postoperative period following congenital cardiac surgery. In your center, who are these patients who get sent for potential catheterization?
Mostly these are young children, infants, neonates, who have had complex congenital heart disease surgery and early in their postoperative course are doing very poorly. So they're a high-risk population to begin with.
So what did you want to look at with this paper?
Well, we're asked commonly by our surgeons and our ICU staff to help in the management and even in the therapy, the treatment of these patients. And so what I wanted to do is look and see if this was making a difference. Number one, is it safe and is it effective?
So how many patients did you look at?
We had about 90 patients, and they had some of them underwent more than one procedure in the early postoperative period. So
these are definitely high-risk people who are in desperate need of some information that a cath can give them.
That's right, yes.
So what did you find?
Well, we found that in general this was a safe procedure, even when you take very small neonates, 5, 6 pounds even, who've just had a complex operation. It is possible and it is safe to take them to the cardiac cath lab and under general anesthesia, perform a diagnostic catheterization and at times even an interventional procedure on them.
Now theoretically, postoperatively, it should be a higher risk period.
Yeah.
So is it the great care that gets taken? I mean, what explains the positive results that you're seeing?
Well, I think one thing that our paper highlights, and we mentioned this in the discussion, is that it's a real team approach. We have the surgical team available in case there is any misadventure. We have dedicated cardiac anesthesiologists who provide the minute-by-minute and second-by-second care to that ill child. And then we have the dedicated catheterization interventionalist, myself and my colleagues, who perform and focus on the performance of that very technically challenging procedure.
So what did you find when you took a look at the aftermath? Was there a positive result from most of these cases? Did they get something really valuable information from the catheterization?
That's a great question. I think in most cases, in the majority of cases, our procedure did either result in an intervention at the time of the catheterization or resulted in the surgeon taking the patient back to the operating room for definitive correction. Overall, these patients who are young, infants and neonates, and who are very ill and have had complex heart operations, overall their survival was not great. So survival was was not quite 75% leaving the hospital. So unfortunately, this is a high-risk population, and despite what we'd consider safe procedures, they still endured a lot of mortality.
So what's the clinical take-home message?
Well, in the centers where dedicated anesthesiology and surgical backup are possible, early post-op cardiac catheterization is safe and can be effective for those patients who are not doing well.
And in terms of teamwork, how long did it take you to get a team together that really worked?
Well, it's an evolution, as you might guess, and it still evolves. So we still get better and better every day at this. And I think that our center is like many centers, and we always review our outcomes and then ask ourselves, how can we get better? And so this has been going on for years before I got there, and it continues to this day. And studies like the one that we're discussing, we took back to our own colleagues and said, well, look, here's some areas where we could have done better, and now let's focus on those patients who are really, really ill.
I mean, this is an encouraging paper because these are kids who, in many cases, they really need something, and so you want to know whether it's safe to go in there and do the cardiac catheterization. I think the results of this paper is really encouraging.
Thank you.
And this is coming out in the JACC Interventions for December 2014, so please look for it there. And we also have a cover story coming up in CardioSource World News on the whole topic of congenital heart disease, so please look for that shortly into the new year. For CardioSource World News, I'm Executive Editor Rick McGuire.